Triptans are designed for active migraine attacks, and they work through three different mechanisms. The first is that they bind to serotonin receptors on the blood vessel itself, which causes vasoconstriction. So the blood vessel is actually getting smaller. And this helps reduce the stretch of the nerves that are surrounding that blood vessel. Then they also help block histamines and inflammatory cytokines from getting to your brain, which would cause pain. They help reduce pulsations so you don't feel that throbbing sensation, and they reduce the amount of swelling that eventually gets to the meninges surrounding your brain, which is very heavy in pain sensing nerves. Secondly, triptans help block the release of CGRP, which remember we talked about in the last video in much greater detail. It's a potent vasodilator. So when we block CGRP, we're also blocking substance P from getting to the brain. Substance P is a neuropeptide and neurotransmitter that is released by damaged tissues with the goal of producing pain and inflammation. And thirdly, triptans help influence descending inhibition, which is the process by which your central nervous system regulates pain signals so that you just experience pain more appropriately. So under normal circumstances, say you have an injury somewhere on your body, that pain signal travels from one nerve to the next, eventually to get to your brain so that you experience that pain. Well, we have things called inhibitory interneurons, which release serotonin and norepinephrine in between these nerves, literally blocking the transmission of excitatory neurotransmitters, mainly CGRP and glutamate, so that only appropriate amounts actually get to your brain. Triptans bind to serotonin receptors on this first nerve, again, putting a halt so that neurotransmitters can't jump to the next nerve. It's just doing the job of the inhibitory neurotransmitter. So this is a pretty impressive mechanism, but there are some limitations to it. First, it assumes that your migraine is being triggered by the trigeminal nerve, a release of CGRP, and blood vessel dilation. If it's not, these just aren't going to work for you. Now, the second issue with triptans is they're binding to the serotonin receptor, which is unique to blood vessels, but not unique to the blood vessels going to your brain. This receptor is found in all of your blood vessels. So when we activate this, that means every blood vessel throughout your body is going to constrict. So we're going to see things like chest tightness, flushing, tingling, dizziness, fatigue, pressure sensations throughout your body, which are unpleasant but completely contraindicated with somebody with cardiovascular disease. So if triptans work for you, or at least used to work for you, this is good news because now we better understand some of the pathways that are causing your migraines, and now we can intervene with ways that are maybe a little bit more supportive of your biology. The first is we need to increase your levels of serotonin. That's mainly what triptans are doing. And to increase serotonin, we just start with the amino acid tryptophan. So getting more protein, easy enough. But we need to make sure that we're getting cofactors in: iron, magnesium, calcium, B6, B9, vitamin C, more B6, zinc, magnesium. This helps convert the tryptophan into 5-HTP and then into serotonin, which can be used to help reduce the frequency and severity of your migraines. We can block the release and binding of CGRP to its receptor with magnesium, CoQ10, curcumin, and the herb butterbur. We can block the binding of glutamate to the receptor with magnesium, and we can increase descending inhibition by increasing serotonin even further. So first we have to understand how nerves actually fire. Along your nerves are sodium and potassium pumps. When they open, sodium rushes into the nerve, which produces a negative charge. That negative charge moves across the nerve as more sodium rushes into the nerve, transmitting that pain signal to the next nerve and eventually to your brain. So on a graph, it looks something like that. That's the nerve firing. Now the nerve has to reset itself before it can fire again. So there's potassium inside of your nerves that then rush out, leaving behind a positive charge. So now we've corrected, but oops, we've corrected too far. So a little bit more sodium comes back in, and now we're kind of back to our initial baseline. Nerve blocks work by blocking this sodium and potassium pump. So after the nerve fires, it cannot reset itself in order to fire again. The great thing about nerve blocks is that we can use them diagnostically as well as therapeutically, because chronic pain is elusive. Where you're experiencing the pain may not be where the pain is being generated. If this works for you, that's great. Now we know that that nerve is involved and we can keep targeting it. If it's not working, great, we can move on to another area because not all pain is being generated by a damaged tissue. It can be driven biochemically and emotionally as well. But of course, there's limitations. This is only temporary unless a longer acting procedure is also used. Now, any nerve that's in the area of the injection is going to be affected, motor nerves and sensory nerves. So side effects are going to include numbness, weakness, soreness, and even dizziness. So unfortunately, there's no way to mimic this naturally, but that's okay because our goal is not just to block the pain signal. Remember, pain is a symptom. It's telling us that something is wrong. It's not what is wrong. So if we block the pain signal, we lose our ability to hone in on what's actually driving your pain. And we're going to lose the ability to determine if treatment plans are effective or not. So instead, treatments need to focus on what's causing this nerve to fire to begin with. Remember, nerves don't fire for no reason. They need a stimulus. So your treatment should help tackle chronic inflammation, improving blood flow, improving metabolic health, and improving central sensitization. In the last video, we talked about nerve blocks in general, but stellate ganglion blocks, a specific type of nerve block, deserves special attention because it specifically targets your sympathetic nervous system, your fight or flight response, which increases adrenaline, heart rate, vigilance, muscle tension, and pain sensitivity. Common to most chronic pain sufferers is being stuck in a sympathetic dominant state where your parasympathetic nervous system just doesn't stand a chance of calming you back down. So now you're stuck in this persistent state of perceived threat, which is driving your chronic pain. See the previous videos about how emotions can drive your chronic pain. Your stellate ganglion is a relay station for your sympathetic nervous system at the junction of your neck and thoracic spine, or your upper back. When we inject a local anesthetic specifically to that ganglion, we temporarily interrupt sympathetic outflow to your head and neck, to your extremities, and to your heart, which just goes well beyond the effects of a local nerve block. So for some patients, this can help reduce pain amplification and hypervigilance and is pretty effective with CPRS and PTSD related pains. But side effects can include hoarseness, drooping eyelids, facial warmth, changes in sweating, and even dizziness. And that's because the sympathetic nervous system is also involved in blood vessel tone, pupil dilation, sweating, and most facial functions. So these blocks can actually be really effective if your chronic pain is being driven by an overdominance in your sympathetic nervous system. But we still want that sympathetic nervous system. We just want it to be in balance with your parasympathetic nervous system. And to do that, in the office, we utilize constitutional hydrotherapies, which are really effective. But at home, we encourage practicing meditation, yoga, Tai Chi, and breath work. And I know, I get it. I'm sick and tired of these being the only suggestions too. But they're the suggestions because the scientific literature is conclusive on them. They work, you just have to do them. There are two types of muscle relaxers. They either work on your central nervous system or your peripheral nervous system. For centrally acting muscle relaxers such as cyclobenzaprine, tizanidine, or baclofen, they're modulating serotonin, glutamate, and GABA receptors. Muscle tone is not just about how ripped you look, it's about the partial contraction that your muscles are under at all times. It's a good thing. It keeps them alert and ready to be used at a moment's notice. So if your muscles were completely relaxed all the time, your fibers wouldn't line up and you couldn't contract that muscle if you wanted to. This is what true muscle tone looks like. It's that partial contraction with a lot of room left for movement. But if your brain is sensing a threat all the time, it's going to increase that tone so your muscles are even more ready to fight or flee a situation. Good in appropriate situations, but for you, the chronic pain sufferer, you're probably not experiencing any real threat, and therefore we don't want our muscles that contracted all the time. Those muscle relaxers help bring it back to just this partial contraction. This is a good opportunity to go back to previous videos and relearn how emotions in the autonomic nervous system can increase muscle tension, soreness, and pain. Now, the nice thing about these centrally acting muscle relaxers is that they don't interfere with normal muscle function because of the specific receptors that they are targeting. Now, peripheral muscle relaxers don't work on the central nervous system, but directly on the muscles themselves. So, on all of your muscles is a little receptor called calmodulin. When a calcium binds to calmodulin, you get a contraction. As long as calcium is bound to calmodulin, that muscle will stay contracted. In order to relax that muscle, we need to kick off that calcium and replace it with a magnesium that allows that muscle to relax. So these peripheral muscle relaxers work by binding to this receptor so that you can't bind calcium. Therefore, we're going to reduce some of that muscle tone, which is great, but the muscle relaxer is not selective to the muscle that is tight. It's going to work on all of them. And if we can't as easily bind calcium anymore, we might experience some reduced muscle function and coordination. So there's quite a few things that we can do to support your biology to help reduce that muscle tone, achiness, and pain. The first is increase magnesium consumption so that we can kick off that calcium and allow the muscle to relax. But we also need to improve blood flow so that we can get more oxygen to that muscle, and we need to deliver more energy, more ATP, because it takes more energy to relax a muscle than it does to contract one. And this is a mitochondrial dysfunction issue. So blood flow, mitochondrial dysfunction, all things we talked about in previous videos. Now, centrally, we need to work on the autonomic nervous system. If you are in a constant state of threat, even when it doesn't exist, your brain is going to override everything that we're doing and keep that muscle tight. So, and I know you're tired of me saying this, and I'm tired of saying it too, but this is where we introduce constitutional hydrotherapies, meditation, yoga, tai chi, and breath work, because these are the things that actually work. They're free, they're easy, you just have to do them.